Okay, perfect. So today I'm excited to share a few updates from our celiac program and highlight how this work is really driven by the community that's here today and our patients and their families. So before we begin, I'd like to acknowledge that everything you'll hear today, our programs, our research that we're sharing, our ability to bring families together has been made possible through philanthropic and community support. This work is not work we do alone or in isolation. This is work that we do with families, our patients, and I hope as I share these updates today, you'll really see the impact of that support and the opportunity to continue supporting the work that we do. So at the core of our celiac program is a very simple goal: to ensure every child with celiac disease lives a full, vibrant life. And to do that, we have established a multidisciplinary program aimed at treating the medical, nutritional, emotional, and social needs of our patients. We are actively working to bring together clinical care, research, and community support to improve the lives of our patients. And in the next few slides, I'm going to share ways that we're actively doing that right now. So first is Celiac Strong, our event today. This is really our flagship community event. This is what you're experiencing. We want to thank all of the wonderful vendors that are here donating their time. And it's designed to bring together families, patients, clinicians, and researchers all in one place. And we're not just showcasing the latest innovations in research and clinical care. We're hoping families will be able to see that you're not just managing the disease, right? You're seeing what's coming down the pipeline in terms of new research innovations. We're also providing nutrition guidance, sharing tools, and fun activities families can take home and actively use. And most importantly, I believe is really amplifying a national voice. So really raising awareness and helping shape what pediatric care looks like moving forward for our patients. Outside of large events, we also focus on building small, more personal connections through our Happy Gut gatherings. These are family-friendly events where families can connect and feel supported. They happen on a monthly basis. Dr. Jericho here has been amazing in helping coordinate this. And we've really built a strong sense of community, which has been amazing. And just as importantly, we have created a space for children, adolescents, families, adults, siblings of children that have celiac disease to meet other families like them, because that sense of belonging is incredibly powerful, and we want to further facilitate and grow that. And really quickly before I move on, these programs grow when families show up, volunteer, and help us build this community together. And while programs like Happy Gut gatherings focus on supporting families in the day-to-day aspects of their lives, we're also working to transform how we understand and manage celiac disease through research and innovation. And that's going to be the next few slides. So one new technology that we are hoping to deploy is wearable ultrasound technology for celiac disease. This is pretty awesome. I think it's a new innovative approach where we are hoping to develop and transform care for our patients. So currently, traditional or conventional ultrasound, what you see here on your screen, gives a snapshot in time, but it's limited. It's operator dependent, right? You have a clinician performing the procedure, and it doesn't show what's happening in the day-to-day, right? It's a snapshot in time. What's exciting about wearable, it's not showing up. Oh, there, okay. But it just, okay. What's exciting about wearable ultrasound technology is that it allows for continuous real-time monitoring of gastrointestinal function. Like active monitoring, right? You're wearing it day in, day out, not just that one time point that you would get with a traditional medical ultrasound. So what does this mean? This means that we can actually begin to understand how a patient's body responds to gluten over time, not just in a single clinic visit. And it also opens the door for us to be more objective and start developing more personalized care, moving beyond symptom-based management to data-driven insights into how your body is operating. And we've actually developed an initial prototype with our collaborators, Dr. Ju here. And our goal with additional support is to make this wireless, more user-friendly, and scalable for a broader use. Right now, it's bulky. We want to condense it. We really want to make it more pediatric-friendly, have a longer battery life. So this is what we're really hoping to do in the next stage. Another innovative research area that we're excited to share today is intestinal organoids. This is work by Dr. Calvin Kuo here at Stanford. And what's exciting about this is that we're now able to grow patient-derived intestinal cells, essentially creating a model of celiac disease outside of the body. So it's really celiac disease in a dish. Very cool. What this means is we can actually study how the disease works in real time, without putting patients through additional procedures, without having to do a gluten challenge. It's really innovative work that Dr. Kuo is working on right now. So what we can do with the organoids is actually introduce gluten, so feed the organoids gluten, and observe how the immune system responds, mirroring what is happening in your body, that intestinal inflammation that comes from it. But the real opportunity that this has the potential to unlock is first understanding the disease at a much deeper level, testing potential treatments, therapeutics for celiac disease, and moving toward more personalized approaches to care. And this is how we begin to move beyond managing celiac disease and towards developing new therapies, new innovative approaches to be able to treat the condition. So everything that I've shared, from community programs to our leading edge research, really has been made possible through support, through community support, through philanthropic support, donations that we've received. And there are many ways to be a part of this. The first one, obviously, is philanthropy. It helps fund programs, research, and patient support, the work that we do. Volunteering, like today, we had wonderful volunteers show up and help us set up. There's also volunteering opportunities in terms of our Happy Gut gatherings. So if family members are interested in getting more involved, we would love to have you participate and join us as we continue to build our community here at Stanford. And then one big thing that I'm very passionate about is participating in the research. We have a lot of research studies that we are actively recruiting for, and we would love to have families be able to participate. That organoid research that I just mentioned with Dr. Kuo, that's only made possible by biopsy tissues through an endoscopy that we were able to use for him to be able to create those organoids. The wearable technology, that's going to only be able to be used and useful for patients if we actually can first have patients participate in the research to really test it, see how effective it is. So our call today is to ask families to join our studies. And we also have some amazing studies that Picha, our senior clinical research coordinator, is going to share about our celiac school study later on as well. That's another opportunity. And then the last piece is to advocate and engage. So help raise awareness and really strengthen our community in terms of the work that we do. So whether it's your time, your voice, your support, there's always going to be a place for you in this work. And then my last call is that our foundation team is outside actually today. And if you'd love to learn more, we would love for you to connect with them. And they're also more than welcome to reach out to me if you're interested in research opportunities or participating in research or volunteer opportunities. Happy to have you join. We have a family listserv that we use to put the call out for big events to help. And for students that are here, I am authorized to sign for your volunteer hours. So I'm happy to sign for you. So with that, thank you so much for your time, your passion, and for being celiac strong. I'm going to hand it over to Pete.